Today, I will talk about the various types of brushes for peri-implant treatment. When peri-implantitis occurs, there are many cases where it is very difficult to treat. So, I open the flap like this. When the bone is exposed, I brush or a brush is mainly used. And now, there are non-surgical therapies like scaling or root planning. The second is a treatment that corresponds to gingival curettage. And the third is a method for treating the surface among surgical therapies. So, this is a model with gums. Think of it as having gums on this model. And first, we apply swabbing anesthesia. Doing a little swabbing anesthesia makes it much easier. After using the swabbing anesthesia and the Minocline dental ointment that you often see, I specifically use it usually with a flowable resin tip. After attaching the flowable resin tip, first I apply the swabbing anesthesia inside this. I put in the minocycline. After putting it in, the most recommended non-surgical therapy is right. It's the Gingy brush. The Gingy brush is used with chlorhexidine inside it. When you press the button, chlorhexidine solution drips from the inside. You see it, right? Insert the tip into the socket and clean it. It almost goes all the way to the socket base. You could say it gets cleaned very well. So, to debride the contaminants inside this is how it's used. Similarly, insert the tip into the palatal. You can use it like this. So the first principle is to first perform swabbing anesthesia. After performing swabbing anesthesia, carefully insert the flowable resin tip. Squeeze and insert the Minocline dental ointment. After squeezing and inserting the Minocline dental ointment, then connect the Gingy brush to the pocket base. This is how to use it. This falls under non-surgical therapy. Next, the type of brush that corresponds to gingival curettage is. I would recommend the T-brush for now. The T-brush is used at a speed of 2000 RPM to 10,000 RPM. This is the T-brush. First, insert the T-brush into the inside of the pocket like this. After inserting it into the inside of the pocket, you turn it like this. You should turn each implant thread for about 10 to 20 seconds. Go down below and then go down further. You repeat it like this. But the angle doesn't align parallel to the long axis of the tooth. If you tilt it about 15 degrees, it will go in. It will go in much deeper, reaching the bottom part of the implant thread. We can do the cleaning. This is a method that corresponds to gingival curettage. It is performed under anesthesia. As you can see right now, this is made of silicone material, so it tears easily. The same goes for the gums. If there's a bit of inflammation, it feels loose. If not, we can keep the gums clean and unharmed. Just keep the part with the implant thread neat. You can do the cleaning like this. Another brush is the L brush. The L brush is also used inside the pocket base for implants that have developed peri-implantitis or peri-implant mucositis. You use it by inserting it like this. If you set this at an angle of about 15 degrees, you can indeed do the cleansing much more neatly. Similarly, you use it by moving for about 10 seconds for each implant thread. The T brush and L brush that we just used can also be used in surgical therapy. It can also be used in surgical therapy. And now, what is used in complete surgical therapy is: if periimplantitis has significantly progressed to this extent, there would be various methods. There are two methods. One is resective therapy. The other is reconstructive therapy. So right now, at this very moment, in cases of vertical bone loss in the bone housing, we will perform reconstructive therapy. Then it comes out like this on the outside of the bone housing. In cases of bone resorption, it would be appropriate to perform resective therapy right. Yes, so like this. Now, this side needs to undergo implantoplasty. Performing implantoplasty. This side is reconstructive therapy. The outside should undergo resective therapy. It seems that using it this way would be better for a combination defect like this. I will show you how to use the R brush. The upper R brush is generally used when you can remove the implant crown. And inside the R brush package, there is a cap like this. There is a protective cap. After connecting the cap to the abutment screw like this, you twist it and fit it in like this. So this will be the protective cap, right? In this particular state of the process, you should carefully mount the brush onto the designated holder. After mounting the brush, the first thing you need to do is you position it so that the brush tip goes down to a certain level. Then step on the implant engine pedal. By stepping on the pedal, do it for about 10 seconds per area. Next, go down to the next thread. Also, do cleansing for 10 seconds per thread, then go down to the next thread. Doing it this way prevents the inner hexagonal structure from getting damaged. We can do the cleansing well. You can't perfectly cleanse all cases with the brush. So the tool being used is, after using the brush, I can similarly also use the L brush. With just one brush, it addresses the defect at the bottom. It's difficult to keep the surface of the implant clean, so I cleanse the bottom area with the L brush. You can use iBrush too. I definitely also use the T brush. So I make sure to cleanse all the way down to the thread at the very bottom. And what I mainly use is, it's the innovative iBrush that was introduced first and foremost. The iBrush can be considered almost all-purpose for surgical therapy. We can cleanly remove everything down to the very bottom. Regular brushes are, in general, a bit thicker. The iBrush goes in very cleanly to areas that are difficult to use, and when there is vertical bone loss. If we can't properly perform debridement on the side, even if granulation tissue remains, the iBrush can cleanly remove even that granulation tissue. I usually enjoy using the combination of the brush and the iBrush. Next, the material that I am going to use is called Hibonex, which is known for its unique properties and effectiveness. It is a specialized material that I often rely on for various applications due to its reliability and performance. It would be best to clean it physically right. That's the best. When you can't help but not be able to reach the defect bottom area well. In that case, put this in here. Put it in like this. Detoxify for a total duration of about 1 minute. I do another cleansing with the eye brush. Yes, when this happens, the surface of the implant becomes very clean. There are physical methods to clean it as well. It can also be cleaned using chemical methods. If there is no Hibonex, you can also very easily make and use a minicline solution in your home or laboratory if you prefer. And now, after cleaning it, the next thing we need to do is, now the resective therapy is all done. We are now transitioning to a more detailed exploration of reconstructive therapy, which is designed to restore both function and appearance and offer significant benefits. So, we will fill this back part with graft material. The exterior of the building has been meticulously cleaned, ensuring every corner and surface is spotless and gleaming. It will just be left in that condition. If there is no prosthesis like this, such as this one, which is essential for many, we could also consider primary closure if there is a prosthesis, even when the prosthesis cannot be removed. Using the eye brush, L brush, and T brush, this treatment is possible. With that, I will conclude the demo.